I've received so many questions. I see so many questions coming through here about healthcare, medicine. You talk a lot about this, and I know you want to reform healthcare. I know you want to limit the power of big pharmaceuticals, especially looking at things like advertising. That's only allowed in the United States and New Zealand, nowhere else in the world. But we are suffering as a whole, as a society in the US, from chronic disease, 6 out of 10. So my question to you would be, what exactly, beyond the limiting of power, are we going to do to reverse those trends? We're talking about individual health, but also society health. What actions would you take as president to try and reverse that?
I'm very excited about that, about kind of recalibrating what NIH does. NIH used to be the premier gold standard scientific research organization in the world. But it no longer does that. What it does now, its primary job is being an incubator for new pharmaceutical products. Mm-hmm. And that has not made it. And of course, the mercantile ambitions of those individuals of the agency as a whole have subsumed the regulatory function of the agency. So now the agency really wants, its purpose now, its real purpose is to get Americans to take more and more drugs, find a drug for every ailment, and then get people, addicted to it, so that the agency gets and its partners increase their power and wealth, and everything is according to the pharmaceutical paradigm, and we need to unravel that, and we need to make it so that the agency instead is studying chronic disease and studying how to keep people healthy. And why have autism rates increased from 1 in 10,000 in my generation to 1 in 34 in my kids' generation? Why have peanut allergies suddenly appeared? Why have all these autoimmune illnesses, rheumatoid arthritis, juvenile diabetes, Crohn's disease, lupus, 100 others, suddenly appear around 1989? What's causing it? We know it has to be an environmental exposure or toxin because genes don't cause epidemics. And, I'm very excited about going into NIH and saying, hey, let's try to really figure out how to keep Americans healthy, how to end the chronic disease epidemic, how do we build immune systems? So that people can resist the disease without the drugs. How do we get Americans off drugs, which is now the third largest killer of Americans after cancer and heart attacks? And that's really, I'm very excited about that. I know that I'm going to be able to do it, and I look forward to doing those kind of meaningful reforms that are going to change the lives and improve the quality of lives of so many Americans.
I mean, it's incredibly essential. We all need that help to improve our lives and that support system. And I think government plays some role in that. But, there's the other side of that, of medical freedom. You look at states like California that want to punish doctors for misinformation, keep back alternative and different types of integrative therapies, even supplements. NAC, NMN are on the chopping block with the FDA. How do you go about that and keeping medical freedom open without stepping on those lines of the state's power?
First of all, I'm going to do a lot of that from NIH. I'm going to, start NIH actually doing science on stuff that doesn't make pharmaceutical industries money, and give it equal time to chiropractors and to osteopaths and to integrated medicine doctors, alternative medicine, and all these kind of, alternative therapies that are just dismissed because they don't make money for the pharmaceutical company. Let's do some real science on them. Let's find out, let's test the drugs that we're using in a way that actually makes them, make sure that they're making us healthier. And let's test alternative treatments too. And not just bind ourselves to the pharmaceutical paradigm. And then on the state level, I don't know exactly how I'm going to, one of the problems with the state governments is the power of these medical boards, which are the instruments by which doctors are getting deplatformed and delicensed. And there's got to be a way to from the federal level to begin making those medical boards actually focus on what they ought to be focusing on, which is making sure that doctors are healing patients rather than promoting, rather than what they do now, which is just to punish people who are not selling enough pharmaceutical drugs or who are questioning pharmaceutical drugs.
Yeah, no, it's incredibly important that we look at medicine differently, I believe. And I think the way you're starting to look at it without sick care and moving it truly to healthcare is the way forward.